The concept of the hotline is this, is that individuals can call our disease control number, the command center, and indicate that they are looking to have a conversation about being triaged and screened. They will their information will be taken. A provider, we've made provisions that providers can support this remotely. So a provider will then receive their information and provide a call back at a designated time. The provider will then ask them a series of questions, screen them, talk to them about their symptoms, determine if they meet the criteria, so to speak, to receive the test, and then we'll order a test in the CRISP system that provides the individual with a referral to any of our alternative test sites, or depending upon their insurance status, they may be referred to other venues that would make provisions for that testing. So we realized that in our efforts to expand testing, a lot of testing was related to having a doctor, and then a lot of testing, even in our alternative sites, we created spaces that, you had to have a car, even though we were trying to make them geographically open. The reality is many people were still locked out of the system because they did not have access to a primary care provider. We heard lots of stories where individuals who didn't have insurance or have a primary care provider say, I showed up to an urgent care. The test was free, but I was being charged a couple $100 visit fee that they didn't have the resources to meet. And so even in our efforts of working through our safety net clinics to provide referrals to our alternative test sites, we recognize that having access to a provider, because you had to have a referral, you still have to have a referral, was a major obstacle. And so what we wanted to do is we figured, how could we remove that obstacle? How could we remove that barrier? And so this is just one piece of, again, I've used the term before, our testing buffet, that we are creating multiple entry points for people to be able to utilize to get access to testing, regardless of their insurance status and regardless of their relationship with a primary care provider.
And I want to say we're trying to get that message out to people because people have been frustrated by the costs of the urgent care centers. If they don't get tested, that just complicates our problems. So we need people to get tested. I have urged people who work in the community to send people to the clinics, which they know and have familiarity with, and to contact them. They'll be able to contact the hotline.